I'm Florence Jondo and welcome to Olsem Wanem. In this week's episode, we placed a spotlight on hypothermia and what it does to newborn babies.
In Papua New Guinea, 5,000 to 6,000 babies under the age of 1 month die every year, mainly from preventable causes such as pneumonia. While pneumonia is widely heard of, hypothermia is another killer that is not widely known. Hypothermia occurs when the body temperature of the baby falls below 36.5 degrees. With UNICEF's technical support, an implementation research was conducted by the National Department of Health in partnership with Pediatric Association of PNG, University of PNG, University of Goroka, Port Moresby General Hospital, Goroka Provincial Hospital, and a local community in Hanganofi District in the Eastern Highlands Province.
Same last time you will agree to the walking inside of district. So with that, we thank you for the BBL of time and effort. There's a time you should spend inside of district, inside of bush, like I said, Mama na being and being Bahat tribe, you mean Lord help.
It's not about our national problem, it's a global problem. So what is happening for last 25 years, the under 5 mortality, the infant mortality, that means under 1 year, under 5 years, is reducing substantially. But under 1 month, that is a neonatal period, is more or less stagnant over last 25 years. It's mainly because we do not have specific program or intervention for this reduction of neonatal deaths. But fortunately, with support of DFAT, government of PNG introduced one program called Early Essential Newborn Care Program in 2015, and over this 3 years, the program is going well. DFAT supported $2.5 million for this program, and as I told you earlier, the program has been scaled up to 95% of health facility in 11 provinces.
The program began with training of all health workers at all health facilities. Doctors, nurses, midwives, and village health volunteers were trained for the program to be rolled out.
So before this program, there not much orientation on this hypothermia. Many people, parent and service provider, they were fully aware about the hyperthermia, means fever, not about the hypothermia. So through this, we could able to create an awareness among the parent and the service provider, health staff about the importance of hypothermia, who is a key killer of newborn baby.
Welcome back to the program. The Early Essential Newborn Care, or EENC, is a set of simple interventions that benefit all mothers and newborn babies. This is a program that was piloted in Eastern Highlands Province in 2015.
The EENC program was piloted in Eastern Highlands Province in 2015 and has just been evaluated by the Center for Disease Control in Atlanta, USA. At the Goroka Provincial Hospital, a special care nursery serves as a 24-hour state-of-the-art referral unit and deals with complicated births. These units help to reduce mortality rate of sick newborns, particularly among the low birth weight babies. It has the capacity to accommodate 20 babies.
We keep the sick ones here and then treat them, and then when they get better, we discharge them with the mother. Okay, for the low birth weight babies, we keep them until they pick up the weight, and then up to 3 kilos or so, and then we discharge them. Around 2.5 is the maximum weight that we can discharge them with the mother. And then we monitor them from the clinics every weekly until when they are better, we discharge them with the mother.
The units have supported the facility by providing technical assistance for the training of the staff and supplied equipment and established the quality control mechanism. The initiative is also based on the principle of the continuum of care linking the community.
Mi plauga tol plus mama mi plus ta mi plus awoki garden na kai kele. So planti ol wok mi plus ameki mi ose mi plus awoki lo level blo mi plus. Na planti tu mi plus kam osem bisa one family home mi plus tape kain kaina samla mi plus widow samla ol two married samla man lusimole mol meri ose mi plus awok. Mi play at lighting mi play woki pledge blo mi play ose mi play no wok lo money na cargo. Mi play work lo saving life lo mama na baby. Mi play kama po select na handle health center se.
Igat visit time lo mi plasta. Time mi play karim lo house sick. Okay, put him this land now will go. Day 3 mi play first visit. Okay, day 7 second visit. Okay, day 28 I'm 1 month old. Mi play toki mo lol kisim kam na mi play house in this.
The partnership of local NGOs in getting village health volunteers in this project is important as they assist pregnant women and mothers with their newborns. In addition, having the proper referral system.
This time we thought, we will provide you all the funding. Let them go to the remotest place where there are not enough midwives or doctors, so that they will do two things. One, not only they will serve the community, they will also train the workers who are there, who have never been trained after their passing out from the school. So with that, they agreed and they posted them in 5 of the remotest health centers out of 31 health centers. In Eastern Highlands Province, there are 31 health centers.
You're watching Olsem Wanem. A hypothermia alert device was also piloted in the Eastern Highlands Province and is locally known as the Bebi Kol Kilok.
During the rollout of the program, a new device to detect hypothermia was also piloted in Eastern Highlands Province. The device, locally known as Bebi Kol Kilok, and the research findings showed many advantageous experience by mothers who had their babies wear the device in Hanganofi district.
This is called a hypothermia alert device, and locally we call this as Bebi Kol Kilok, means baby cold clock. So what happened? This device detect hypothermia or any problem with the baby. So normally the child is warm, healthy, so no problem. It gives a blue color. So every 30 seconds it gives a blue color. So a mother or caretaker, when they see there is a blue color, they are quite sure the child is active, is normal. If there is any orange color or a alarm, that means the child is hypothermia. The temperature falls below 36.5 degree.
And number 6 baby, Lolnara pla baby, this la baby and different than all 5 pla baby mika. So time Kol Kilok can wear him grow 8 days. So I'm making baby grow fast. Then all narapla baby wears a grow low months. So me have a maslo this la Kol Kilok type kisim putilo baby. We look at difference.
When the alarm is on, it signals the parents or the caretakers that the baby is cold. A special technique called the kangaroo mother care is performed on the infant.
Mother has to put the baby on skin to skin contact. That is called kangaroo mother care. The way kangaroo keep the baby, her baby, similarly the mother or caretaker, father, just put the baby on skin to contact.
To complement the device, the UNICEF program has also set up community-based care where it trained about 38 health volunteers to assist mothers and newborn babies at the village level. These women are frontline workers who visit newborns at their households 3 times in the first week of their lives. During the visits, the workers assess the newborns, promote healthy practices, manage simple problems, and refer those with serious illnesses.
Mama of all VPAs na mi place I was all walk about. Wanem have call in go and to place I karim you wanna talk save lo all VPA mama. Lo kam lo disla kain pum.
Lo time titju office origi mama ikam lo LLG promi plan of Fiantina. Wanem have phone emino save go logan. Mi save karim tok save lo walk about lo Krami mountain broken wara broken bush na help him all tok save all mama.
The success seen in Eastern Highlands Province has prompted the rollout of the EENC in the Southern Highlands Province, beginning with 2-day training for health workers in Mendi.
We conceptualized and tried to pilot one of the comprehensive newborn care initiative. This talks about newborn care at all level. All level means at the hospital, provincial hospital level, there is a special care nursery where if the child is very sick, they admit the child and provide special care. At the health center level, so there is a EENC, Early Essential Newborn Care, trained health staff equipped with all life-saving equipment and other equipments. So they provide the initial care for the newborn. It's called stabilization of the newborns. And at the community, at the household level, we train village health volunteers to identify the problems of newborn and refer the baby urgently if there is any high risk signs and symptoms. So care at the community by village health volunteer, then special care at the provincial hospital by pediatrician, by medical officer and midwife, and in between care by the ENC trained worker at health center. This model with a proper referral transport from community to health facility and referred back. This is the model of comprehensive newborn care initiative.
The EENC program costs around 140,000 kina and is part of the national policy and national neonatal healthcare strategy that is contributing to Sustainable Development Goal targets to reduce neonatal mortality to 12 per 1,000 live births.
That's why it's so important that this program is being rolled out. It's something that's had great results in these villages, and it's something that we hope that the rest of PNG can benefit from as well.
Welcome back to Olsem Wanem. To sum up this week's episode, we give an update on the polio outbreak in the country. Polio is a very dangerous disease that causes paralysis in non-vaccinated children. There is no cure for polio but can be prevented by taking the polio vaccine. Polio is spread from person to person by contact with the stool of infected people. Since the declaration and certification of the eradication of polio in the year 2000 in PNG, the first confirmed polio case was found in Morobe province in June 2018 in a 6-year-old boy.
The polio is very infectious, and if the children is not immunized, almost 9 to 100% of the children will be infected. And although the evidence suggests from all the province, all other countries, if we can have sufficient immunity among children on 5 years old, we can sufficient to contain this outbreak.
Mass polio vaccination campaigns were launched in the 3 high-risk provinces.
We have launched vaccination campaign. The first one, the vaccine campaign in the Morobe, Eastern Highlands, and Madang province on 16th. This will be last about 2 weeks. Hopefully, by these 2 weeks, we will cover all the children under 5 years old in the 3 provinces.
The vaccination campaign will run until October.
The containment of polio needs a very high coverage, and we need to reach every children of the target population. We say that 300,000 children in the 3 provinces, scattered all the province, all the geographic area. The most difficult task is to access children and to make sure the vaccinator can reach the family, all the 300,000 children one by one. That's probably the most challenging part. But we know the government has organized a huge campaign. Up to now, they have 2,900 vaccinators in all the 3 provinces to try to reach all the children we are targeted to.
611,000 doses of polio vaccines procured by UNICEF in support of the polio immunization campaign have arrived in the country and distributed to health facilities in the 3 high-risk provinces.
They confirm these cases, and the Global Polio Eradication Initiative already support the government to immediately ship the vaccine to the country, and through UNICEF. As we know, there are 610,000 vaccine already in country, which is sufficient for the province for 2 rounds. And we are going to, the partnership, we're shipping more vaccine to the country to support the vaccination campaign for the whole 4 round.
Dr. Luo is urging everyone to join in the campaign to end this polio outbreak.
Every concerned person in population should inform the public about the dates of vaccination campaign, which is ongoing now. And then we have another 3 rounds, which is in August, September, and October. Benefit the children to make sure that all children are benefiting from the polio immunization. And all of us should be provide public accurate information related to polio immunization. We should encourage all people to embrace the routine immunization, which is fundamental for the prevention of all vaccine preventable disease, including polio. And all us should work with the health authority and as partners support the polio eradication program.
That's all the time we have for this week's episode. Thank you for watching, and if you have any comments or stories you would like to share with us, please send us an email via the address now showing on your screen or visit our Olsem Wanem Facebook page. Until then, I'm Florence John Duo. On behalf of the entire Olsem Wanem team, pleasant evening.